Hi everyone, my name is Elizabeth, registered psychologist from Prosper Health Collective. So today I'll be talking to you about the question, why are there so many different types of approaches or types of therapies like cognitive behavioral therapy, psychodynamic, acceptance commitment, emotion-focused therapy, etc. Now to some of you, these are really just labels and it really doesn't matter as long as you get what you expect at the end as an end outcome. But for some clients, this might be something of an important question and might be something that you've perhaps even researched for a long time before considering which therapist you might want to see. So why are there so many different types of therapy? Is one therapy necessarily better than another? So in short, the answer is it depends. In general, therapists would have been trained in different evidence-based approaches. So some types of therapy approach would have been proven through very rigorous research to be effective for specific mental health challenges. So for example, cognitive behavioral therapy is a common approach to treatment of anxiety and depression because it brings an awareness and understanding on how your thoughts might influence your behavior. For clients who struggle with emotional and behavioral dysregulation in particular, they may, however, find the structure and the skills-based format associated with or offered by dialectical behavioral therapy or DBT to be more beneficial compared to other types of therapy. Now, this does not mean, therefore, that other types of therapy doesn't work. They would still be effective, but it really depends on how compatible that approach is with the client in question and the personal preference. For this reason, you may find that therapists often do not just operate based on one pure single approach of therapy. You may find therapists drawing essential elements from different approaches, evidence-based approaches, that allow them to best tailor the treatment suited to the person's needs and goals. So bear in mind as well that, when we talk about effectiveness of an approach of therapy, often there is this tendency where we feel like, okay, if this is effective, then it must surely work for me. But when you bear in mind that effectiveness of treatment actually depends on more than just the type of therapy approach the therapist use. There are also other factors in play, and an important one is the relationship you share with your therapist. So remember that the process of therapy is actually a joint effort between you and your therapist. You can be confident that your therapist would really welcome a conversation with you if you ever feel like that therapy approach is not working, or if you're just uncertain. Is it working for me? Is it not working? Why is it not working? Have that honest conversation with your therapist. If you are considering attending therapy, or if you would just like some additional support or a chat, please feel free to reach out to one of us at Prosper Health Collective. Thank you.